أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن مع العسر يسرا إن مع العسر يسرا فإذا فرغت فانصب وإلى ربك فارغب صدق الله العظيم. Sir, thank you. Hello everyone, welcome to today's Cardiac Super League Grand Finale. To move forward, I would like to call upon the person who is our moderator of this program, who injected the real energy, enthusiasm, and spirit throughout the program, Dr. Hamza Ghori. I would like to say one line to share your expertise was critical indeed to succeed this event. Please welcome the one and only Dr. Hamza Ghori, who is the Assistant Professor in Rawalpindi Institute of Cardiology.
Bismillahirrahmanirrahim. Honorable Chief Guest, esteemed panel members of Pakistan Cardiac Society, respected faculty members, my fellow colleagues and residents, ladies and gentlemen, Assalamu alaikum. I would like to take this opportunity first to welcome you all to this grand finale of Pakistan Cardiac Super League. And this is the second season. We have had 18 teams put together. And now we are in these finals. And the city is Lahore. For this match, we have the hosts, which is Punjab Institute of Cardiology, Hawks. And we have Multan Institute of Cardiology, Panthers. So let's see where it goes, but I know one thing for sure, that it's going to be victory for everyone. A few words about the journey on a personal note. It has been a wonderful journey for me, especially to be affiliated with a grand league of this stature. I think Wilson's Pharmaceutical put up a wonderful show. I was lucky enough to have had the pleasure of working with such stalwarts and stars of cardiology. So thank you very much, sir, for guiding me and all the residents and the teams all the way through. Thank you very much. It wasn't easy putting it up. I think starting from the questions that were prepared, the reviews that were done, the programs that were conducted, the internet that was managed all across Pakistan in those testing times, and then making it all happen. And especially credit goes to the teams for putting up a wonderful show. So I think we'll just move across to the screen to have a few visuals pointing out the journey that we've had together. Yes, thank you very much, and thank you for all the applause. I think they all need it. With this, I'm now going to move towards the introductions. First of all, I would like to introduce our chief guest for the day. And we've been honored to have Professor Javed Akram Saab. I think words will not do justice. He's a renowned physician of the country, ex-Vice Chancellor of University of Health Sciences, advisor to Royal College of Physicians, United Kingdom, Tamgha Imtiaz, and a long list of accolades continues. Welcome, sir. Great to have you. With this, I now move to our stars. In fact, it's a galaxy. We have Professor Hafizullah, a renowned cardiologist. Sir, it's great to have you. I think he injected the power and enthusiasm and everything that we needed. So thanks for joining us for this wonderful event and the whole show. Professor Javed Akbar Syal, he's been instrumental. Thank you very much, sir, for your presence always. I could always find you there most of the time, and thank you very much from your region. Professor Feroz Maiman, he's always there guiding us, and I think his smiling face, but he's always there. Professor Fawad Farooq, I think I look up to him. He's such a fascinating person. I think he's a great person to have who's on your back. So it's always great to have you, sir. And I think no show is complete without you. We have Dr. Ali Raza with us. It would be great to have him here. I don't know whether he's here, but yes, he's joining in. Professor Shehbaz Sarwar, he's with us. Sir, it's great to have you. Professor Amber Ashraf, I think woman power, that's what we are looking for, and hopefully we'll have her here in the ranks. Professor Tariq Abbas, sir, I think words cannot do justice, so it's great to have him. I hope he's there as well. And we have Professor Ahmed Noman, another shining star in cardiology. So as you can see, and most likely we're going to have many more. And now I'm moving towards the umpires. So that's a Chief Justice, it's a special category. He's the soul of the show. So we have Professor Ishaq Saab, and nothing was possible without him. It's definitely last but not the least. He's the... Yes. So thank you very much, sir, for everything, all that you've done for us. It's always amazing to have him. I think he has a major role. We have Professor Khavar Abbas Kazmi with him, and he's there to guide the two teams. And I think this is the show that must go on. So I think as we have more people joining in, we'll move in. I'll have the introductions as I used to have during the show. Now, moving to the match. So we have the two teams ready, and I'm going to ask both the teams to go for the introductions, and I think I can move forward. So I'm going to randomly ask MIC Panthers, the captain, to give the introductions, please.
My name is Dr. Farooq Riaz, and I am the captain of the MIC Panthers. And to my left is Dr. Arslan, and on the right, Dr. Adnan and Dr. Sadia with us.
All right. Welcome to the show and this grand finale. Best of luck to you. And now I'm going to move towards PIC Hawks, the captain, to give the introductions, please.
Assalamu alaikum all. My name is Dr. Abdur Rahman, and I am finally a resident at Punjab Institute of Cardiology. I am captain of PIC Hawks team. On my right side is Dr. Zarguna, and on my left side, Dr. Anwar and Dr. Shaheed.
Welcome to the match and the finale, and best of luck to you guys as well. So the conditions, as we all know, the pitch looks good. We are expecting a high-scoring game, but at the same time, it's quite murky. So you may have some visual issues. That's the smog in Lahore, but still, we are hoping for a good show. All right, so now we move to the all-important toss of the coin, and this time it's not electronic, so I'll request both the captains to join me here. So it's going to be a physical coin toss. All right. So we have the coin, heads and tails. Hosts, go ahead, roll it. All right, so the news from the center is heads it is. So that means you call heads. MIC Panthers have won the toss. Please take your seats. So nicely put up, Son Halwa. I think they'll have 2 questions to deal with. So number 1, do you want to take the questions or you want to throw the questions?
We want to throw the questions.
Well, they want to throw the question, and now I'm going to pose them with the second question. So you will have 2 scenarios in front of you, 2 veneers. You want A or B?
We want B.
You want B. All right, so you want to throw the questions.
Yes.
And you want case series B. So that's the news from the center. Well done. All right, sir, do I have the permission to start the match and have the first innings? All right. So can we have the first veneer, the first scenario on the screen?
A 60 years old diabetic hypertensive gentleman with 30 packs years history of smoking presents in the OPD with complaints of intermittent chest discomfort on exertion for the last 1 year. The patient also complains of dyspnea NYHA class 2. On examination, his heart rate is 90 beats per minute, blood pressure of 148 by 94 mmHg. Chest examination reveals bilateral equal air entry. ECG shows sinus rhythm with delta waves and borderline PR interval suspicious for WPW pattern. The patient states that he underwent calcium scoring 3 years ago, which was 300 agaston units. His lipid profile shows total cholesterol of 200 milligrams per deciliter, LDL-C of 120 milligrams per deciliter, and HDL-C of values of 40 milligram per deciliter.
All right. Thank you very much. So, Hawks, you want to take a couple of seconds to gather your thoughts? Let us know when you're ready. All right, they are ready. Okay, can we have the first question on the screen?
What is the pre-test probability of obstructive coronary artery disease in this patient based on the calcium score? A, low risk, B, very low risk, C, moderate risk, D, high risk, E, very high risk.
All right, your timer starts now. 60 seconds. Twenty seconds.
So we will like to go with the option D, high risk.
Are you sure? You want me to lock it?
Yes.
All right, lock D delta. High risk. Lock it, please. Oh no. That's the first miss. An outswinger. I think you missed it. I told you murky conditions, so you've got to be watchful. All right, never mind. You still have 9 more questions. PIC Hawks. You need Hawkeyes. So can we have the second question?
For global risk assessment and evaluation, the patient undergoes a biochemical panel. All of the following investigations are appropriate for this patient as per the recent ESC CCS guidelines to 2024, except A, HbA1c, B, RFTs and electrolytes, C, HSCRP, D, fibrin, E, fibrinogen.
All right, timer 60 seconds on your screen. We also have Professor Tahir Sayuddin Almani from Multan Institute of Cardiology. Welcome, sir. It's great to have you. Twenty seconds. 9 seconds. 7.
So we will go with the option E, fibrinogen.
Option E, epsilon, fibrinogen, right?
Yes, sir.
Okay, lock E, fibrinogen. Oh no! Goodness. Second miss. Another one. Going past your outside edge. There's a lot of swing, I guess, or there is something wrong with the visibility. Never mind. Question number 3 on your screen.
The patient undergoes an echo that shows EF of 60% with diastolic dysfunction grade 1 and mild concentric LVH. What is the next most appropriate investigation? A. ETT, B. CT coronary angiogram, C. Invasive coronary angiogram, D. EP studies, E. None of the above.
60 seconds on your screen. Let's see if this one goes over the long on boundary for a 6. Approaching 20 seconds.
We will go with the option C, invasive coronary angiogram.
All right, so you want us to go with option C, invasive coronary angiogram. Are you sure? You want me to lock it? He's eager to score. Lock C, Charlie. Oh no! That's 3 in a row, PIC. Okay. All right. Okay, silence please. I think this is getting intense, Lahore, I know. Come on. 7 more questions, you can still do it. Can we have question number 4?
The patient undergoes CT coronary angiogram that shows dense focal calcification in mid-LAD with 80% diameter stenosis. As a result of which of the following artifact would the luminal diameter stenosis be overestimated? A. Blooming artifact, B. Blossoming artifact, C. Image noise, D. Banding artifact, E. Step stair artifact.
60 seconds are on your screen. Hawks, be very careful. Twenty seconds, now 15, come on.
Sir, we will go with the A, blooming artifact.
You can do it. Come on, let's see.
Blooming artifact.
You want me to lock alpha A, blooming artifact?
Yes, sir.
All right, lock alpha A, blooming artifact. Yes, that's the first 6. This one is definitely over long on for a 6. Well played, well done. And Hawks are on the board now. Lahore is now geared up. They have faith in the team. It's back. All right, next question on your screen.
The patient undergoes coronary angiogram that shows 40% stenosis, 40% stenosis in mid-LAD with dense calcium and a distal LAD muscle bridge. A decision is made to proceed with medical treatment based on the data given. What is this patient's ASCVD risk? A, low risk, B, moderate, C, very low, D, high, E, very high.
And the timer starts now. If you want to take a look at the vignette, you can always go back. If you want to see the scenario. "25 seconds to go."
We will go with the option D, high risk.
Okay, you want me to lock D delta, option D.
Yes.
Okay, lock D delta. Yes, that's another one. Well done, and this one is over covers. That's very well played. Well done, PIC. They're back on course. MIC looks a bit worried, but you see, this is what it's all about. So, best of luck to you both. So, we have 12 runs on the board. All right. Half of the questions are gone, half are left. Question number 6 on your screen.
Based on the patient's ASCVD risk, high-intensity statin is contemplated. Which of the following would qualify as high-intensity statin therapy? A. Atorvastatin 20 mg, B. Atorvastatin 40 mg, C. Pravastatin 80 mg, D. Rovastatin 80 mg, E. None of the above.
And the timer starts now.
40 to 80. 40 to 80. Forty to 80 है 40 to 80
एशियन जो है वो 40 और यूरोपियन है वो
Sir,
This one is a bouncer, I think. Either it's a 6 or a miss. You will be caught. Let's see.
we will go with the option B, atorvastatin 14 milligram.
Are you sure you want me to lock B beta? Okay then, lock B beta, option B. Yes, that is the right answer. Very well played. Hooked for a 6. Well done. This bouncer, very well negotiated. Well done. Question number 7 on your screen now.
The patient is counseled regarding dietary modifications. Which of the following advice will be appropriate? A. Reduced intake of complex carbohydrates. B. Reduced sodium intake to less than 1500 milligrams per day. C. Polyunsaturated fat should constitute less than 10% of daily calorie. D. Both B and C. E. Both A and C.
The timer starts now. So MIC thinks it's an in-swinger. Let's see. Twenty seconds to go.
D.
Come on. 10.
We will go we will go with the option D, both B and C.
Are you sure about it? You want me to lock D, option B and C. That's delta. Okay. Lock D delta. Oh. Well, they were right. It came in onto the pads. LBW. All right. Okay. Moving to the next one. Question number 8.
Which of the following will be most appropriate for this patient's smoking cessation? A. Varenicline, B. Bupropion, C. Long-term NRT, D. E-cigarettes, E. None of the above.
And the timer starts now. Come on, PIC, we need another 6 from you. I think your institute is at the edge of their seats. Approaching 20 seconds.
We will go with the A, Varenicline.
Okay. Option A, alpha. Varenicline, right. Okay, lock A, alpha, and let's see. And yes, well done. That's a wonderful stroke, definitely a 6. Very well played and much needed. Well done indeed. Okay, so now the second last question of this innings. Question number 9.
Regarding the muscle bridge in LAD, which of the following medications can worsen the chest pain? A. Beta blockers, B. Calcium channel blockers, C. Aspirin, D. Nitrates, E. Statin.
All right, timer starts now. 60 seconds on your screen.
nitrates होते हैं ना, but beta blockers से
Okay, I think Ishaq Saab won't be happy. You've come down the wicket. You're not taking your time, Ishaq Saab. He's not utilizing the time. He says
D, nitrates.
D nitrates. All right, lock D delta. Wow, so that's nicely played, flicked off your pads, well done. So we're in the game. We are in the game, right? Okay, the last question of this innings. Question number 10 on your screen.
Which of the following is the most common site for muscle bridge? A. Proximal LAD, B. Mid LAD, C. Distal LAD, D. Mid RCA, E. Proximal circumflex.
All right, 60 seconds on your screen. I think PIC mentors are really eager. Eye contacts are going on. All right, never mind.
Option B, mid LED.
Again, he's come down the wicket. He's going for a 6 straight over the long on boundary. Should we take it, sir? Which option?
B, sir, mid LED.
Sir, B, beta, mid LED, lock beta. And yes, very well done. Wonderful, wonderful. So I think you caught up well in the end. And now can we have the total score on the screen? Divine intervention, maybe intervention from the eyes, we don't know. But I think they've done well in the end. And we needed a good score, so the score is 36. Well done. This could be a competitive total. And I think very well done. Best of luck to MIC. With this, we come to the break and the half. And I think I would like to take the comments from our worthy panelists. And first of all, it has to be Professor Mohammad Ishaq Saab. Sir, can we have the mic for Professor Saab?
Scenario was quite a straightforward. CT angiogram is very widely practiced modality, and I think the questions were pertinent, and they did very well. I mean, 36 is not a bad score given the competition that we had in the past. So I think it's going to be a tough competition.
Sure.
And let's hope what the other team does.
Very right, sir. So Ishaq Saab is always there. He's guiding us. He's guiding the way through. And I think it's extremely important. But I'm not going to ask him as to who's going to win because he's one of the umpires. That would be unfair to him. Sir, your comments, please. What do you think?
That's an excellent effort from the both teams. Actually, इनकी जो physical मेरा ख्याल first है, तो initially they become थोड़ा सा उनको feel some shy and then came back very well, well did, and I think so. It's congratulations to both teams. They came to here with competition of I think 36 teams, and already you are winner both teams. So best luck to both teams.
Thank you very much, sir, for your kind words. Yes, indeed, we had 18 institutes doing wonders. We have Professor Sayal. So your comments, sir?
Excellent. It's an excellent competition between two teams, and it is the first time in history, because if you remember last year you didn't come at Sakhar and one team was online. So that finale was also online. So the first time, and dynamic is totally different. Dynamic is totally different, and I have been involved in this both seasons, and practically I repeatedly say that we are learning from these young people, and with the standard of questions, some questions are so difficult, some are mediocre, but they are working hard. So congratulations both of the team, and I assure both of the team that one of the trophy they will get. So they don't go from here with empty hands. So that's congratulations to both.
Thank you
of
very
them.
much, sir.
Thank you.
I think comments from sir also.
Very good questions, which are very clinically very relevant and very properly framed. I congratulate you on this setup. Thank you.
Thank you very much, sir. Indeed, I think a lot of effort goes into it. The whole panel of doctors from all across Pakistan was involved, and they have done a wonderful effort. I think this is, you'll see in the end how this whole effort is going to blossom, and I think we're very close to that moment. So with this, I think I'll take permission from our worthy umpire. Do we have the permission to start the second innings? All right, so are we geared up? Okay, so can we have the scenario on the screen? Read the scenario, please.
A 55-year-old gentleman known case of diabetes and hypertension is brought to ER in collapsed state. As per the patient's wife, the patient has had recurrent episodes of chest discomfort at night. Over the past 2 weeks on examination, he is pulseless and BP-less. Rhythm strip on the cardiac monitor shows a polymorphic ventricular tachycardia.
Okay, so you can have a couple of seconds to gather yourselves, Panthers, and let me know when you're ready. Okay, so are we good? Okay, then can we have the first question on your screen? A bit louder, please. Yeah.
What is the next best step to do? Option A, synchronized cardioversion. Option B, unsynchronized cardioversion. Option C, IV adrenaline. Option D, IV magnesium sulfate. And option E, IV calcium gluconate.
And your 60 seconds start now.
We would like to go with the option B, unsynchronized cardioversion.
You want to go with option B, unsynchronized cardioversion. So again, you've come down the wicket and you're trying to heave it over somewhere. Should I lock it?
Yes, lock it.
Confident?
I hope so.
Okay. Option B, beta, lock it. And yes, he was surely confident. Well done. Very well done. That's a great start. It's a 6 and very well played. Well done. All right. Can we have question number 2? Read it, please.
Immediately after cardio what should be the next step? Option A, assess pulse and rhythm. Option B, continue CPR and reassess after 2 minutes. Option C, continue CPR and reassess after 3 minutes. Option D, IV lignocaine. And option E, IV amidon.
All right, 60 seconds on your screen. I think there's a lot of discussion going on. The crowd, the audience is also engaged. Even they are trying to figure out the answers.
And we would like to go with the continuous CPR reassess after 2 minutes, option B.
You want to go with option B, beta. You really like B, I guess. Huh? All right. So I think you're playing T5 or T10. It's a T20, mate. All right. So he wants me to lock it. Lock B, beta.
Yes, lock B beta.
Yes, yes. Well done. That's another 6. Very well done. So he seems to be, in fact, they seem to be pretty well acquainted with the smog, Lahore. But let's see what happens. You never know. We have seen funny things in this game. All right. So 12 on the board. Can we have question number 3?
The CPR is continued, airway is secured with an left LMA and the end tidal carbon dioxide is being monitored by the team lead. Which of the following will be most appropriate surrogate of ROSC? ETCOT of less than 5 mm of mercury, ETCOT of less than 10 mm of mercury, of 10 to 20 mm of mercury, more than 20, none of the above.
All right, your timer starts now. So is this going to be a googly? Let's see. The coaches and mentors, I think they are also trying to figure out the answer. It's a good one. Is it going to be a hat trick of correct answers in this grand finale? 20 seconds to go. 15.
Option beta, Charlie, sorry, ETCO2 of 10 to 20 mmHg.
Okay, you want me to lock C Charlie, right? Okay then, lock C Charlie. Oh, that's the first blemish of this innings. Goodness, the correct answer was option D. Never mind, you still have a lot of questions and we want a tight game, to be honest. We want it to go to the wire, don't we? All right, moving to question number 4.
The pulse is reassessed after 2 minutes, which is now present. Non-invasive blood pressure comes out to be 110 by 70 millimeter of mercury. The patient remains unconscious. ECG is done. That shows T-wave inversion in the inferior leads. What should be done next as per the recent ESC ACS 2023 guidelines? Option A, activate cath lab and prepare for immediate PCI. Option B, prepare for hypothermia at 30 to 36 degrees Celsius for 12 hours. Option C, prepare for hypothermia at 32 to 36 degrees Celsius for 24 hours. Prepare for hypothermia at 34 to 36 degrees Celsius for 12 hours. Or prepare for hypothermia at 34 to 36 degrees Celsius for 24 hours.
And your 60 seconds start now. All right, so Lahore, do you think they are getting it right, this one? Approaching 25 seconds.
मेरे ख्याल में यही है कि ऑप्शन अल्फा की तरफ ही जाना चाहिए.
20 seconds.
We would like to go with the option alpha. Activate the cath lab and prepare for the immediate PCI. Patient is high
Okay,
risk for.
speaking like a true interventional cardiologist, you want me to lock A alpha? Should I lock A alpha?
Yes.
Okay, lock A alpha. Oh no! Yes, it's the wrong answer as per recommendations and guidelines. Okay, so it's getting interesting. It's definitely getting interesting, and I will request the audience to, I think, in the honor of the two teams, we would like to keep it quiet so that they don't get confused. Please. All right. Can we have question number 5? Quiet, please.
Patients' cardiac troponins are advised. Which of the following protocols are endorsed by the recent ESC ACS 2023 guidelines? Option A, 0 to 1 hour protocol. Option B, 0 to 2 hours protocol. Option C, 0 to 3 hours protocol. Option D, 0 to 1 hour and 0 to 2 hours protocol. And option E, 0 to 1 hour protocol and 0 to 3 hours protocol.
And the timer is on your screen. 60 seconds.
ऑप्शन ई के साथ
Approaching 25 seconds.
3 hours प्रोटोकॉल यही होना चाहिए. Option E, 0 to 1 hour protocol and 0 to 3 hour protocol.
You want me to lock E epsilon? Option E. All right. Lock option E. Oh no! That's another one, and it's an inducker that you've missed. So, I think it's the visibility is going down, I guess, in Lahore. And Lahore is excited. All right. So, half of the questions are gone. 5 questions to go. You can work it out. So it's getting tighter. Best of luck for the next question. Question number 6 on your screen.
Patient's oxygen saturation are 91% at room air and chest examination shows bilateral equal air entry. Based on the ESC 2023 ACS guidelines, what is the appropriate terms of oxygen therapy? Option A 2 liters, option B 4 liters, option C 6 liters, and option D 10 liters. Option E no oxygen therapy needed.
And the timer starts now.
No oxygen therapy needed in case.
Sorry?
So option E.
Okay, you want me to lock option E? E epsilon. No oxygen therapy needed. All right. Are you confident about it? It's an important one.
I hope so.
So he's hoping. Let's see whether it's hope against hope. Lock E epsilon. And he's hoping correctly. Well done. You were absolutely right. Very well done. Good answer. Good answer. All right. So moving to question number 7.
The troponins assay come out to be 450 picogram per ml. The patient has a heart rate of 110 per minute and blood pressure of 122 by 70 millimeter of mercury. He has been administered dual antiplatelet therapy, statin, heparin. Which of the following medication will potentially reduce adverse cardiovascular events? Option A, oral metoprolol. Option B, IV metoprolol. Option C, nitrates. Option D रह गया. Morphine and metoclopramide, and option E, oral metoprolol, nitrates, morphine and metoclopramide.
All right, so I think it's an error. It's option D. Timer starts now. All right, so you've got to be very careful. 4 questions to go. You need all 4 of them MIC to win this game. Or else we may have to go into
Option
super over.
alpha oral metoprolol.
Are you sure? You've come down the wicket again.
Yes.
And
I
you
hope
want
so.
to put it into the stands.
Mortality,
Over long off.
Mortality benefit is with oral metoprolol only.
Okay. You want me to lock it? A alpha. Okay, lock A alpha. Oh my goodness.
No, it's not like that.
Oh. So this one turned out to be a googly. It was a googly or a dusra.
We want to discuss this scenario.
Okay, hold on, please. I think we have the umpires. I would need all of you to concentrate. This is the moment we were all waiting for. So I would request our umpire, in fact, both the umpires, Professor Isaaq and Professor Khabar Kazmi, to please share their thoughts. They are contesting. They want to confirm whether this is correct and they want to maybe have a review.
Okay, they want to have review. We'll have to go back to the original formulation of the question and the references. So we can call them, you see. Whoever
Right. So, team, can you help us with that? I think they want to have the reference. Do we have the reference for this?
Yes, I think each question had a reference, you see. And if somebody has an idea right now, I don't think we can make a decision. We have to go back to the original question and the references.
I think the answer is correct. IV metoprolol is the right.
Yeah.
This is an acute situation, and this time it's not a chronic situation. So I mean, oral and metoprolol will be the next step after IV metoprolol.
What is the reason for you to dispute? Do you have any reference or any you can quote from the literature or?
I think, sir, I have read in a trial where the IV metoprolol mortality benefit was negated because it causes as well the hypertension and other problems. That was IV metoprolol was.
वो तो long term बात करें ना, ये तो acute phase में है इसको.
Okay, so I think I'd like to add here, this has been reviewed, and as we all know, this is as per ESC 2023 guidelines, and when you have a heart rate of more than 100 and 110, which you can see in the initial Vinay, it's the IV which is the need of the hour. The idea is to control the rate. In that acute setting, it's the IVs.
Okay, sir.
All right.
That's fine.
Yes. So I think this is backed up by the guidelines. But I think this is, if they have a confusion, that's why we have the umpires and the reviewers. So,
But usually, Hamza, our rule of this league is that we don't stop in middle of the
yes,
game.
yes.
You can submit your whatever query you have. We can come up with it again afterward. Let's continue with the game. Whatever the answer is here,
Yes.
that will be accepted.
So they'll have the review anyways, but I think just to,
We agree to the senior.
okay, so they do agree. I think we just wanted to have a discussion. So well done, both the teams, and I think we are going to move on. We are going to move on. Right. So can we have the next question? Now you can tie in the next three questions if you get them right. You get them wrong, obviously we know who the winner is. But then we have the option of getting into an eliminator situation. All right, question number 8. Read please.
Which of the following trials support the use of IV beta blockers in setting of ACS? Option A, commit or CCS2. Option B, MetroCard. Option C, ISIS1. Option D, commit or CCS2 and MetroCard. Option E, MetroCard and ISIS1.
All right, your timer starts now. 60 seconds. It's getting interesting now. Every question is important. Ten seconds, come on. 9, 7. Right. Okay, so you want me to lock option A. A alpha?
Yes, Alpha.
Are you sure? Extremely important question.
Was lock it option.
So if now they are correct, they continue. And if it's a wrong answer, then we have a winner, right? Okay. So we are going to lock A alpha. Lock it, please. Oh! All right. Thank you very much. I think wonderful match all around. So commiserations to MIC and congratulations to PIC Hawks. It was a close game, but I still think it's the match which is important. So the show is not over yet, and I will request you to hold on to your seats, right? So with this, I think I'm now going to ask our worthy guests, our panel of experts, to give their opinions. And I think straight away, Professor Ishaq Saab, we need his comments. Please, can we have the mic?
I think we came a long way at reaching over here, you see. And I would like to congratulate both the teams. I don't think anybody has lost today. Both are going with ek badi hai, doesn't matter. It has been a learning experience for all the participants, including the faculty, the umpires, everybody. I think it was a very novel idea of educating our youngsters, and I must congratulate and compliment Wilson Pharmaceuticals for this novel idea. I've been part of this throughout the matches, and the standard of questions are very good, very relevant. Some of the questions were difficult, of course. Out of 10, 2 or 3 questions were always difficult, at least for me. So it was difficult for everybody. And but I think both the teams have done very well. 18 मैचेस के बाद यहाँ पहुँचना इज़ अ ग्रेट अचीवमेंट. और nobody should be discouraged कि हमने lose किया है. Nobody has lost. It is a continuous effort and process of learning. We should continue. And Professor Noori साहब मेरे साथ बैठे हुए हैं. He will bear me out that हम लोग जब practice कर रहे थे तो guidelines वगैरह इतनी नहीं थी. Now we have to abide with the guidelines. And sometime एक question एक answer जो है वो हमें लगता है कि ये ठीक है लेकिन वो ठीक नहीं होता because the guidelines say something different. The important thing is that we should compliment the people who have formulated these questions behind the screen. हम लोग तो screen पे आ जाते थे, मैं भी और हमारे और दूसरे colleague भी और comments भी करते थे, लेकिन जिन्होंने question बनाए हैं, I think I would like to appreciate them for their efforts to make these questions a difficult task. And they have produced with references. I've been reviewing most of the questions, and all the questions and answers were supported from the evidence from the literature and latest guidelines. So I think both the teams should be congratulated, and with a sportsman spirit, one should concede. But as Javed Sial has already said, nobody is going without a trophy. So both of you going with trophy, and of course Lahore has done better this time. हालांकि इतना बड़ा score नहीं था. We had much higher scores in the previous matches. This was a very modest score, and yet you couldn't match. So sorry for you, but at the same time, it's a successful completion of the league of the season, and I think all of us are very happy to conclude this and celebrate it. Thank you very much.
Thank you very much, sir, for your worthy comments. I will request the other umpire, Professor Khabar Kazmi Saab. So please, your thoughts.
Okay. First of all, I mean, I think congratulations to both teams. Obviously, I think the winners are on the top of the world at this time. But I think in life, sometimes losing is as important as is the winning. And it is not important whether you win or lose. It's the effort you have put in and what have you learned out of this exercise. They were saying this morning, I think learning is something which never stops. Everyone keeps on learning. And in fact, the day you stop learning, then you are not alive anymore. I mean, you may be physically on the earth, but you are not alive anymore. So the process of learning is what keeps you alive, and knowledge is what gives you strength. So I think thank you very much for accepting. Everyone, it's a whole team effort. I mean, a lot of effort going into this thing. So thank you very much, and we look forward to another successful season, inshallah, next year.
Thank you very much, sir. Professor Nawaz Shari Saab. Sir, your thoughts.
So excellent effort by the MIC team. You did well. और congratulations to the PIC team. Excellent job. और मेरा ख्याल है great knowledge. Their questions are very overall some easy and some questions even were difficult for us also as being if I'm the part of your team. So both team did well. So congratulations to all team, and the congratulations to the whole team that gathered this all of the postgraduate, and this is actually good activity in order to make some academic interest in the candidates, students especially. So congratulations to Wilson and the people who had formulated the questions and this show this program.
Thank you very much, sir. Professor Noori Saab, sir.
I think an excellent effort by both the teams, 4 each on both the sides, but well done, Punjab Institute of Cardiology.
Thank you very much, sir, for your kind words. Right, sir. Right.
Congratulations, PIC, and best of luck, MIC, for next year. Thank you.
Thank you. So can we have Professor Fawad Farooq? So we'll have you in the end. So yes, Professor Fawad, we were missing you in between. You just sneaked out.
मैं बस एक शेर कहूँगा, शिकस्त फतह मियाँ इत्तफाक है लेकिन मुकाबला तो दिले नातवा ने खूब किया. तो वो चीज़ें जो already discuss हो चुकी हैं, I'm not going to repeat. The important thing to running this whole activity for an year without any gaps and hurdles, with the challenges of that internet and all that, I think all the organizers, and especially the Wilsons, are really need a round of applause for that.
So no doubt it was a big effort because I used to be transported from my cath lab to that center.
Second is for Hamza. He is there in every match and moderated it so well that it is so engaging even in a virtual environment. So
Extremely humble, sir. Thank you very much. I think it's the whole team effort. The credit goes to them. And yes, Firoz sahab.
Thank you, Hamza. I think I must say appreciate both the teams, but you have done a wonderful job for last whole year and made us stick to our seats. Such a suspense thrill you created. Congratulations, Lahore PIC. And I think equally congratulations to MIC Panthers for having a good fight. Now, 2 years back, Bilal from Wilson's came to me with this idea. I was Director Academics in PCS, and I thought it's a very difficult task. I put it in the council. The council appreciated and we started. First year was very difficult. We had a lot of technical problems, questions, histories, problems, objections, but we have overcome those. And I think now it has been a smooth sailing with difficult task, a good sense of competition, spirit. And I mean, these PGs are going to be better physicians than us because they are going to be our physicians. So thank you very much.
Inshallah, so thank you very much. And we do have the support from Multan, Professor Tahir Ulmani Sahab. Sir, can we have him? Where is he? Yes, yes.
Congratulations PIC team. मैं शुरू में मैंने उनसे बच्चों से कहा था कि अब सब हमारे बच्चे हैं, जो भी जीते हम सब जीते हैं. तो congratulations sir, congratulations.
Thank you very much, sir, for your words. And I think we would like to have a few more comments. Yes, Professor Amir Bandesha Sahab, please.
Thank you very much. What I feel that life is a race. One should keep on running. Chances are there always to win and to lose. So I am from Multan. My heart is with Multan, and my brain is with PIC.
The heart betrayed you? Is that so?
Yeah. Tahir Ulmani is my teacher. He is our senior, and we all work together. So it's a great show. We should keep it up. Thank you.
Thank you very much, sir, for your kind words. And I think with this, we now move to... Sir, please. Please.
I just want to share with the House that in 18 matches, we had 3 occasions when there was a dispute. But luckily, all these disputes were settled on the table during the session. And today I would like to thank you once again that you agreed, didn't pursue for didn't insist that we should go for clarification and reference and all that. So that means there has been a very good sportsman spirit. There has been no conflict. 18 matches ka ho jana smoothly without conflict. It's a great achievement. And I think I have been very lucky that I was there in all these matches. And I just remember 1 or 2 occasions there was some disagreement, which was settled very amicably. Thank you.
Very, very right, sir. Everything was handled amicably. I think the credit goes to all the 18 institutes and their teams. They were absolutely wonderful. So with this, I now would like to request our worthy chief guest, Professor Javed Akram Saab, to please grace the stage and have a few words.
Bismillah ar-Rahman ar-Rahim. Wonderful experience. I myself was learning a lot. And I work with the PCB, Pakistan Cricket Board. I am heading their health and medical division. And I was just thinking, and I was texting them that Hamza should be inducted as a commentator. So they were asking me what sort of expectations are attached to that. I said I'll ask him. And also Hafiz was sitting next to me. his grandson is going to have circumcision soon, so I thought Mufti Sahib will be very good to recite some Quranic ayat. So he was also asking me how much it's going to cost me. So I said, I'll let you know. So I think a wonderful start with Mufti Sahib's, mashallah, recitation of Holy Quran, beautifully recited, and then follow up with, I think you both are the main winners today. And I think Mufti Sahib has agreed with me while I was going for namaz that he will be our official Mufti of PSIM, of which I am a part of, Pakistan Society of Internal Medicine. And I'm sure Hamza can be the moderator for all our plenary sessions. So congratulations to everybody here. At our age, we might be needing intervention anytime, so I'm very impressed by our next generation of interventionalists here, potential, that we are hopefully in safe hands, and hopefully, inshallah, they will lead the cardiology. I mean, really looking at these youngsters, one is so encouraged, the potential, the talent here, and I'm sure they will be very, very. I can just add a little bit to what you. I think both of you are winners in any case. I don't think there is any loser here, as all of us said. I will say that both of your teams. Actually, I also represent, as Hamza said, Royal College of Physicians as international advisor. So all 8 of you can avail MTI training for 2 years, SHO job, 3,000 US sterling pounds per month, and residence training for 2 years in UK at your convenience. So you can contact Mufti Sahib if you want to go to UK. You have a 2-year job exempted from PLAP, and you can be going in few weeks time for 2 years. This is just a bonus for you. So once again, wonderful being part of it, and I'm very grateful to Wilson, Mufti Sahib, to Hamza for conducting it so well. And I always say life is about creating memories, and this afternoon it's not only memorable for the contestants, it's made memorable for us all. Thank you.
Thank you very much, sir. It was truly an honor to have you. And one thing is for sure, I think I won't be able to sleep tonight. The dreams are getting bigger. So let's see. So with this, I think I will now, sir, request you to please come over. I'm going to bother you one more time. I think now there are small mementos that need to be distributed. So I'm going to request the team. So, all right, can we have the shields first? And I will request our worthy chief guest to distribute them. So we'll start with our panel of experts, our faculty members, highly esteemed faculty members, and we are going to start with the 2 umpires, Professor Dr. Mohammad Ishaq Saab. Sir. And I tell you, nothing was possible without him. He has been there throughout. MashaAllah. And we look forward to seeing him there for many, many more years to come, inshallah. I'll request our Professor Khawar Abbas Kazmi Saab. We have Professor Feroz Maimun Saab. Please, sir. Again, I think I was always seeing them there, supporting the league, giving their extremely important input. We have Professor Fawad Farooq Saab. The ever so vibrant and dynamic Fawad Saab. We have Professor Javed Akbar Sial Saab. Is he there? Okay. Professor Hafizullah, I don't see him there. Professor Tariq Abbas. Professor Ahmed Noman. So we have Dr. and Professor Amir Bandisha Saab. Sir, please. On behalf of PIC, and I think his support was extremely important for both the teams, in fact.
शील्ड बची है कोई? वो पीछे पड़े.
So I'll request our worthy panel members to join our chief guest, as we are now going to call the runners-up and the winning team. So can we have our panel, please? Ishaq Saab, aaiye. Sir. Firoz Saab. All the panel members, sir. Aaiye, sir. So can we have the runners-up for this grand finale of the second season of Pakistan Cardiac Super League? It is MIC Panthers. And I would request Professor Almani Saab to please join them. And the good news is, they are now going to Pakistan Live 2025, which is going to be supported by Wilson's and Pakistan Cardiac Society. So Wilson Pharmaceutical and Pakistan Cardiac Society. Pakistan Live is going to be held in 2025 in Islamabad. Well done. And now the moment that we've been waiting for since the beginning, the inception of this league. I will now call the winning team of this grand finale of second season of Pakistan Cardiac Super League, PIC Hawks. Well done. Yes, and I'm going to request on behalf of the team, Professor Amir, please join the team. And Dr. Anjum as well. They want you with them, and you deserve it. The PIC team to join them.
Stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up.
And the good news is they are going to Gulf Interventional Society meeting 2025, which is going to be held in Dubai. Well done.
To pick myself back up, and when I fall down, I have to pick myself back up.
Very well done.
And when I fall down, I have to pick myself back up. And when I fall down, I have to pick myself up. Stand up for the champions, for the champions. Stand up for the champions, for the champions. Stand up, stand up, stand up for the champions, for the champions. Stand up for the champions, for the champions. Stand up for the champions. Stand up.
And I will once again request our worthy chief guest to please come onto the stage for his shield and his memento, please. Can we pass it on? So we are also going to unveil something. I'll just like to give you a quick review. So we have had multiple questions in the second season, and this is the unveiling of the book from the second season that has been published. Almost 450 questions throughout the league matches, and this book is out. The effort goes to Wilson's Pharmaceutical and Pakistan Cardiac Society, and all those who've been affiliated with this. Okay, I'll now request the shield to be presented. Can we have the shield, please? Right, sir, so the shield is... Okay, so it's a souvenir for Professor Javed Akram from Pakistan Cardiac Society. Thank you very much, sir, for your time, your support. It was an honor to have you, sir. Thank you very much.